Hi, my name is Paul Dimitri. I am the Vice President for Science and Research at the Royal College of Paediatrics and Child Health. I'm here to tell you today about research priorities that we have at the RCPCH. This is really based upon work that's been done in the past, where we have asked our members and our children and young people what they value as research priorities. They include areas such as safeguarding, obesity, mental health, neurodevelopmental paediatrics, and as you would imagine, this is also linked with social care and public health. What that drove us to do at the RCPCH was to bring a multi-sectoral, multi-professional group together to start to focus on how we get funding to help support research in those areas, those priority areas. So what we did was we brought a group together. This was the Child Health Research Group, which formulated a document that was taken to the NIHR Strategy Board. That was back in 2022. We got unanimous support from all the members of the NIHR Strategy Board. That is one of the highest boards in the National Institute of Health and Care Research, led by the CEO, Professor Lucy Chappell, and all the infrastructure leads and the program leads, as well as other allied organisations, sit on that group. What then happened was a series of meetings with the program leads of some of the research programs to try and identify funding for those priority areas of research. Where we hit upon best was actually our relationship with the program grants group, the NIHR program grants group, that worked with us collaboratively to set up program development grants, which will subsequently move on to program grants to support funding for those areas of need. So the program development grants, they launched in November 2024, and then two research calls came from that for NIHR program development grants to support multi-sectoral, multi-professional research in those high impact areas. So I'll go over those again: obesity, mental health, neurodevelopmental pediatrics, safeguarding, and also in areas of public health and social care. Those research rounds have passed now, and what will subsequently happen is those applicants that were successful will be able to go on to apply for program grants for applied research in 2026-27, in which they'll be able to apply for between £3 and £5 million for a program grant to support their area of research in high impact areas. So those are areas where there is high prevalence of those particular problems. The idea within those grants is that we also build in a capacity build into those grants, so that we make sure that we build capacity into the system so that there are researchers that can take on those research in those areas for many years to come. So where we focus these was on capacity, sustainability, and scalability. So where we could actually invest in the research, create a research workforce to focus on those areas, and then scale that up really to a national level. Finally, is to say that this will all be brought together, that process, in an article that is soon to be published in the Archives of Disease of Childhood, where we'll talk about the process and our desire to be able to move forward with that to support research in those priority areas in the future.